15 right now. A new study shows that deaths associated to preventable heart disease have declined among the elderly. That's the good news. The bad news, that's not the case for younger folks. Our health expert, Dr. Kevin Campbell, here this morning with more. Doc, good to see you.
Good to see you, Phil.
This is eye-opening. When we talk preventable deaths, what do you mean?
So what we're really talking about is untreated high blood pressure, untreated cholesterol, untreated diabetes that down the line actually results in cardiovascular death. I think that today's story may be the most important medical segment that we have done together.
Really?
Absolutely.
Let's talk about it. Let's dig into this study. It came out recently.
It did. Last week, a study was published, and it looked at preventable cardiovascular deaths in ages 75 and under. They're down 30%. However, if you look at these deaths in 65 and under, it's not even half that percentage of reduction.
Wow.
And that is very powerful. It tells us we're doing a great job of preventing cardiovascular events in the older population, but not so much in the younger group of people.
Why is that?
You know, I think a couple of things. If you look at the data, only half of the people age 40 to 60 are being treated for high cholesterol that have it. 30% smoke. In the elderly population, only 5% are smokers. Almost all of them are being treated. I think what happens is we intervene early in older people.
Right.
And then in the younger people, we don't think about heart disease. And as a physician, we need to aggressively screen the people in their 20s and 30s so they don't have these problems.
You just mentioned it, 20s and 30s. What, if you are in that age range, I am, what should we be doing?
So certainly a yearly visit with your primary care provider. Make sure that you get screened for high cholesterol, high blood pressure. If you have a family history of heart disease, make sure you talk to your provider because they may want to do some additional testing.
Anything we can do on a daily basis as well?
Absolutely. How many times have we said it? Diet and exercise. Engage in your own health care. Make sure that you understand what your risks are and you modify those risks and work every day to do that with your physician.
Can't say it too much.
Absolutely.
Dr. Campbell, always good to see you.
Thank you, sir.
And of course, if you have a question for Dr. Campbell, really easy. Log on to our website, WNCN.com. From there, you can also find his Facebook page. You can like him on there, and you can also find his website and his Twitter. Important stuff here, Paige.
Absolutely.